right. Good morning, everyone. It's nice to be starting the in-person presence back a bit. We have everybody else on Zoom, but it is nice to at least have those of us that were able to make it here in person today to welcome our absolutely phenomenal speaker this morning. So it is a distinct pleasure to have with us Dr. Frederick to share his perspectives and experiences as an unparalleled leader in the realm of diversity and inclusion in education and healthcare. I had the opportunity to hear Dr. Frederick speak as the keynote address at the PED section meeting this past winter. And what struck all of us was his candor, his clarity of insight, and his transformation of experience and vision into action and guidance for the next generation. It is truly inspirational. Dr. Frederick currently serves as the 17th president of Howard University, as well as the Charles Drew Professor of Surgery at the Howard University College of Medicine. Dr. Frederick was born in Trinidad and Tobago, enrolling in Howard at the age of 16 to obtain his combined BS-MD by the age of 22. He then trained in general surgery and completed a surgical oncology fellowship at MD Anderson, and since then has pursued an inspiring career as both a surgeon, educator, and advocate, working to decrease healthcare disparities and actively shift representation within the healthcare workforce. His efforts have also resulted in national and international recognition in induction as a member into the American College of Surgeons Academy of Master Surgeon Educators, as well as the National Academy of Medicine. So it is our distinct pleasure and honor to have you with us this morning, and I will turn it over.
So good morning. First, let me thank Dr. Hoffman, who I met at the PED section for her invitation, her very kind invitation. And I'm happy to be here with you this morning. Hopefully, after my presentation, we can have some discourse, which I think is probably more important than what I'm going to have to say, although I hope you pay attention for as long as I speak. The state of diversity in the medical profession is a talk that I've been giving now for probably going on 12 to 15 years in terms of watching the evolution of it. And as I give this talk and collect data, I feel like every time I give it, I'm actually going to be the AOA lecturer tomorrow at the University of Tennessee, and I'm sure by the time I get there tomorrow, my slides are going to change. That's how rapidly this is changing, and slightly different focus, but there are some aspects of this that, it'll take us all day to discuss. But having said that, I do want to touch on a couple of things. So first, just to acknowledge the Executive Committee on Diversity and Inclusion here. Thanks for your focus and again for the invitation. So let me jump right in. Looking at applications to U.S. medical schools by race and ethnicity over the period from 2019 to 2022, one of the things that you'll quickly discover is that the pace of change in terms of the applicant pool is not what I think we would all like to see. Although there are a couple of things that have changed, which I will touch on, especially when it pertains to African-American males in medical school. And what's interesting about this is this has a very long history, which I'll touch on, that started with the Flexner Report, which really decimated the number of African-Americans who would apply and get into medical schools, as well as women, interestingly enough. And that's a report that I have read cover to cover, and I'll highlight a few things in it. Only about 5% of our doctors are Black in the U.S., clearly underrepresented from when you look at the overall population. And then when you look at the number of active MD residents by race and ethnicity, again, you see an interesting number. In 2021-22, only 6.1% were Black. Now, there's a significant projected surgeon shortage over time, and this is something that we've been looking at, talking about. We've been using different techniques and tactics in the country to address this, one of which is obviously adding the number of medical schools that are here as one part of that. And then when you look at practice specialty, especially as it pertains to males by race and ethnicity, you see significant underrepresentation, again, in terms of African Americans by specialty, especially the surgical specialties, and that's something that has continued. But Black male enrollment is one of the things that was of significant interest to me. And you'll see here in 1978, there were more Black males enrolled in our medical schools than in 2019. And that was a significant issue, one that the National Academy of Medicine took on as a project to try to impact. And there have been a lot of theories about this, some of which actually are myths. So one of the things I've heard a lot of times when I go to speak is that there are more African-American males in prison than in college. That's not true. I'm here to tell you that's a myth. At one point, that was the case. That has not been so for well over 2 decades. There are more African-American men enrolling in college. A lot of them tend to be like my 18-year-old son, who's a freshman soccer scholarship athlete at Duke. As a side note, Duke played Howard last season, unfortunately, and he scored his first collegiate goal. But God bless him, he didn't celebrate as I was sitting at the 50-yard line, so I'm thankful for that. But he's a classic example where his major is economics with a minor in finance. I took he and my 16-year-old daughter to the operating room about a year and a half ago, and while she's interested in orthopedic surgery and he's interested in being on Wall Street, when I made the incision, I always look up at anybody who might be visiting because that's around the time that they get a little woozy. They were both fine. I got back to my office and my son said to me, "Dad, I got a rush when you made the incision." And I said to him quite calmly, "I've been there before and it will never leave you. So you could go off to Wall Street, but that bug will never leave you." The point is the exposure that African-American males have or don't have is part of the issue. And the second issue is how we portray some of the field in terms of their expectations, the length of time we have to train, et cetera. And so I think that there is genuinely an interest. And what we saw in 2021 after the pandemic was a 22% increase in African-American male enrollment in medical school. And I have a couple of theories as to why that occurred. One is that they were doing Zoom interviews, and so there was less pressure of how we set up our interviews. And we don't think about this a lot, but it's a factor. We bring people for interviews, we put them in a room to chat, and you know how that conversation goes. There are 2 or 3 people who recognize each other, either from the circuit or they've been together, and the conversation is, "Yeah, I have 6 more interviews, I got to fly to the West Coast." And you sit there with your 1 more interview, and you think, this is not going to go well. So just imagine that type of a conversation occurring around you before you go in. The other thing is we're not always thoughtful about how we set up interviews. I interviewed for surgical oncology fellowship, as you heard, I trained at MD Anderson. But one of those interviews, and I say this only because the president of Memorial Sloan Kettering now is a friend, Selwyn Vickers, and I told him that I say this publicly, and nothing against Memorial, I love the place. But the night before the interview, they got all of the applicants in a room, kind of at a bar, and the goal is to see how many people you interact with and the quality of that interaction. So the fellows are walking around, making little notes. At that time, I didn't drink. I still don't really drink much, but I absolutely didn't drink at all. And I'm extremely shy. So when I come into a room, I go to the corner of the room, which is what I did. And I didn't drink. So I met almost nobody. The next day, in one of the rooms, one of the questions is, how many people did you meet, or did you meet one person in particular that you would like to train with? Right? It's a question to kind of test how well you interact and engage. In a place with cocktails, when somebody doesn't drink, that's a little skewed. So there's this one guy, Dave Kubi, who I met, and luckily I was able to say his name. And funny enough, after we met each other again, and he said to me, "Yeah, I give them your name as well." We're probably the only 2 people who gave each other's name to. But imagine somebody who is an introvert like I am, and that's not your thing. That's one example. The second example is in the second to last room in that interview, I was shown a picture of a black and white picture of an older white male. And the question was, who is this? And so, of course, at that time, I think there was 6 surgeons who won the Nobel Prize. So I picked one randomly and gave that name. It turns out it was actually President Harrison, the United States president with the shortest tenure. He gave a very long speech at his inauguration on a cold January day in Washington, D.C., contracted pneumonia and died 31 days later. I'm from Trinidad and Tobago. My U.S. presidential history is a little thin, right? So again, we don't think about these things. They're done with good intentions, right? You want to see, kind of what else does somebody know outside of medicine? I don't have an issue with that, but U.S. presidential history mightn't be the right thing. There was a gentleman who I actually saw just Friday in Toronto at the American Surgical Association meeting by the name of Dr. Chan Rout. He's now back in the Harvard system. He did U.S. history for undergrad, and he was the only person in the interview process who figured out it was William Harrison. So those are examples where sometimes we have good intentions with our interview process, but we don't set it up in a way to really get what we want, although we say we're looking for diversity. So there's some factors that limit this, right? And one of the things about this is I think we have to have more scientific evidence about this, because this could be a very subjective conversation. And this is one of the few studies, in my opinion, that really went after looking for actual evidence that was not just subjective. So the entering class for Hopkins in 2013 and 2014 were given some implicit and explicit bias surveys to testing to look at. What was interesting about this, and I think everybody in here would agree, the most altruistic person in the world, in my opinion, is the entering medical student. Think about the day before you enter medical school. We all want to cure the world. We would do anything. We'd go to anywhere anybody sent us to do anything to give medicine to somebody. It's probably the most altruistic you'll ever find somebody. So if you really want to get money from somebody, the day before they start medical school is the day to ask them, probably. So they give them these vignettes. And the hypothesis was, like the general population, doctors may possess unconscious or implicit biases. We don't think of that, do we? We think we're going into medicine because we want to be humanitarians. But the reality is we have the same biases that the rest of society has. We bring the same things to the table. This is one example. The question here was, which of these two people would be more equipped to read, comprehend, and sign an informed consent? The white toll booth operator or the black lawyer? And overwhelmingly, the answer was the white toll booth operator by the incoming classes at Hopkins the day before they started medical school. Right? Shocking. You would think there's no way somebody would think a black lawyer is not capable of signing an informed consent. But it is an unconscious bias that we all carry. And so that data was analyzed in terms of race and ethnicity of the participants. This is what it looked like, as you would imagine. Medical school at Hopkins, the largest population was white, Asian American second, and African American represented by 6.4%, again, consistent with national data. The students, as you would imagine, would be in that age range, majority 22 to 25. But clearly, their race preferences tended towards white in all of their answers. Very consistent, almost every single clinical vignette. What was important is that although the implicit racial preferences are present, these did not affect clinical decision-making. And I think that that's important for us to recognize, because the other thing it says is that if we are purposeful in our curricula, we can train our medical students to think something different. Same thing with lower and upper class. And there are other studies that have since been done to demonstrate this. One is a study on trauma patients. If you look at all trauma patients that came in to Johns Hopkins over a 10-year period, within 24 hours, if you control for severity of injury, chronic diseases, those types of things, they all had the same exact outcome, regardless of race. About 48 to 72 hours out, you started seeing a divergence in outcome. And what do you think happened? The patients with insurance started to have a better outcome than the patients without insurance. We've all been there. We've all had that conversation, right? Once we figure out the patient isn't insured, we start having that conversation. Fever, you think the patient has a leak, should we get a CAT scan? The back of the mind thought is, who's going to pay for this? Patient doesn't have insurance. That's going to be problematic. Nobody's having an open conversation, but it is influencing our decision. And before you know it, a decision is made to not get the CAT scan. Let's wait another day. I'll come back and examine the patient in the afternoon. And before you know it, you've made a decision based on a simple socioeconomic circumstance. It has nothing to do with the clinical presentation of the patient. And by so doing, you've then put the patient in a circumstance where the patient now is going to get into some trouble. And so you start seeing a significant divergence about 72 hours out in terms of the outcome. And again, we think that that has a lot to do with it. Now, I think it's important to recognize that I'm not here to beat you over the head about the things that may impact diversity, but I also want to demonstrate to you a few things that I also think are very encouraging and things that we could think about. So a couple of things. Howard was started back on March 2nd, 1867. The 17th president of the United States signed Howard into existence, the only federally chartered, historically black college and university in the country. For those of you, I'm now getting into real U.S. presidential history here. The 17th president, President Johnson, actually was a concession as a vice president to Abraham Lincoln, right? He was from Tennessee. He's considered from the South, so he appointed him as his vice president, never thinking, obviously, that he would be assassinated and this man would be the president. He became the president and actually was the first U.S. president to be impeached. He was a misogynist. He was a known racist. On the day that he signed Howard's charter, and I've read this speech and letter that he wrote, he actually vetoed the first Reconstruction Acts. Did not believe that black occupants, as he described, of the U.S. were true full citizens and therefore should not have full rights. I think he signed Howard's charter as a concession. He thought this would never work, so I'm going to sign it. So one thing I want you to take away from this talk is that our democracy is messy, but it works. Right? Here is a misogynist president who signed a charter to start an institution that educated the first black female vice president of the United States. So I know we get cynical when we open the news every day, but our democracy works. It's messy, but it is going to work. So I want you to be assured about that. This is a picture of the first faculty at Howard. There are two black men in this picture who were surgeons. One of them actually would take care of a U.S. president who was actually shot, would subsequently die because every day the surgeons who were taking care of this U.S. president who was shot would go and poke their fingers in his wound after getting off their horse. So you can imagine what that resulted in. And so that U.S. president subsequently died as a result. But the point here is that two of the surgeons, one of them actually would take care of a U.S. president. So one of the unusual things about Howard University in general is that even from the very beginning, not just that the goal was to educate students freed slaves moving from the South, but also to encourage faculty members who were black and also to have women. So for instance, the first female dean of a dental school in the United States was actually Howard's dean, Jean Singford. So the Flexner report that I referenced earlier. So I decided the first time I was doing research for this talk to try to understand why we have had such a disparity in who attends medical school and what specialties. And so I figured the Flexner report might have been an inflection point. Let me go back and look at the Flexner report. This man went to every medical school in North America, US and Canada, every single medical school, took copious notes to look at the quality of the education, the quality of the preparation, labs. I mean, it was an incredible study that he did. And so this is what I found out. He, in spending that time, was very concerned about the lack of preparation. So by the time he was done and made his report, he decided that there were too many medical schools because the quality wasn't good, and that the number of physicians that were being put out at the time needed to drop dramatically. And his recommendations were followed. Annual output of physicians dropped from 4,442 to 2,000. The number of medical schools decreased to 85 at that time. And the number of students went down from 28,000 to 13,000. I mean, very significant changes he made. The percentage of schools requiring 2 years of college for admission, for instance, rose from 3 to 92. So he clearly had a major impact on it. What I also discovered, which I've never heard spoken about publicly, was this. And these, I actually decided not to paraphrase. I just took the quote that was written in the report. And these are some of the things Flexner wrote. It is clear that women show a decreasing inclination for medicine. So he did not feel that women should become physicians. The 7 medical schools for Negroes, which was the term they used at the time, should be reduced to 2. So by the time my mentor, LaSalle Lafort, would apply to medical school, there were realistically only 2 medical schools he could go to in 1948. Blacks, being a potential source of infection and contagion, needed their own physicians. Hygiene, rather than surgery, should be strongly accentuated in these schools. And so by 1923, only 2 medical schools for blacks remained. And between 1920 and 1964, less than 3% of students entering American medical schools were black. The other thing you would note is that the number of number of women students also was significantly impacted by this report for a long time. And it has taken us decades to overcome that. But it started with this report from Flexner. Now, what I also want you to leave here with today, so this is the second thing I want you to leave here with today, is we all have unconscious biases. So I become the president of Howard, and I decide to go down into the library and study the prior presidents, prior trustees. We've had trustees like Frederick Douglass, and guess what I find out? Abraham Flexner was a member of Howard's board and actually served as the board chairman from 1932 to 1935. So the other thing that I want you to always consider is the context and the time in which some things happen. So I don't think that Abraham Flexner was necessarily a bad person. I think that for the context and the time he was in, he made recommendations based on what he saw, incorrectly or otherwise, but it affected the landscape of American medical education. And we have to acknowledge that. And affected it, I would say, very negatively. But the fact that he went to Howard and became a trustee meant that he had to have a very significant interest in the education of blacks in America at that time. And look at the time that he was there in the 1930s. Howard was a struggling institution, had just hired its first black president, who would go on to change the place. And that first black president is pictured here, Mordecai Wyatt Johnson. He inherited a school in 1926. He was a Baptist minister, 40 years old, with 1,700 students. He would leave in 1960 with a school that totally was transformed. He signed a contract that at the 4th year of the current dean's contracts, they would step down and he would hire a black dean. It was the first really significant black president of a historically black college and university. Another thing in our history that isn't well known, I'm actually only the 7th black president at Howard, although I'm the 17th. So there have been more white men who've been president at Howard University than black men, which is, again, a little known fact. So he really transformed the institution, but obviously he got some help, I'm sure, from Abraham Flexner while he was a trustee. And Howard today is a very different place. We now have a population of close to 13,000. We have 14 schools and colleges, Division I sports. We have our own radio station, our own TV station. It's a very, very different place. So when I look at that enrollment, what do I see? Are students interested in STEM? So is the pipeline really being impacted? And I would stand here today and tell you yes. This slide has to be updated based on what we've seen today. This was 2021. We now have 32,000 applications to the university this year. And the number of students that are expressing an interest, especially in STEM fields, has grown. We actually have a theory around trying to get students to graduate in 3 years. So you'll see that bottom green line. Our goal is to get that to 10% because I think, again, for students who want to go to medical school, when they think of the timeline, I think they're impacted by it. And yes, I'm biased because I did 2 years undergrad and then 4 years med school. Howard has one of the BSMD programs that still exists in the country. But overwhelmingly, our undergrad students are women. 74% are female. The number one major is biology. So right now, I have about 1,000 to 1,200 biology majors on my campus, all of whom start off thinking they're going to be physicians, and all of whom we have to help direct to what they actually are going to do. And I'm a classic example of that. I have sickle cell anemia. I'm homozygous for sickle cell. And the reason I went to Howard was because I wanted to find a cure for sickle cell. I used to practice my Nobel Prize winning speech when I found a cure, et cetera. I went to the operating room and fell in love with surgery, and so got a little bit distracted. I don't regret that, but it's a classic example where in terms of advising, nobody said to me, why don't you become an MD, PhD, or why don't you pursue a PhD, right? I told people I want to find a cure for sickle cell, and they said, you have to become an MD. And that was all the advice I had, and just kind of, went after it. I think one of the things that is interesting is the selectivity that does occur. So we actually have a dilemma at Howard. We enroll 126 students, but we get north of 8,000 applications today. As a matter of fact, this year, 11,000 students initiated an application to our medical school, of which 8,500 completed it. We're only going to enroll, well, we were going to enroll 126. We've decided that we'll take 140 this year. That has left us as the 5th most selective medical school in the country, and that's a dilemma, because almost every black student who applies to medical school in this country applies to Howard. And obviously, we can't take every single one of those students. What's even more interesting is in the fall of 2021, 79 of the Howard students who were accepted into our class were not accepted anywhere else in the country. So Howard was their only shot at becoming a physician. And why is that? And that's because we have a selection bias. We do a supplemental application for the students where they have to identify either what in their background may have disadvantaged them or what they intend to do going forward as a physician to help an underserved population. One of the most interesting applications I've seen was from a white student who graduated from the Naval Academy who wanted to research sickle cell in Africa. Is actually the only medical student since I've been president in the past 10 years who has taken a Fulbright in the middle of medical school and went to Tanzania and spent a year researching sickle cell in Tanzania. That's the classic Howard medical student. So also when you think of diversity, it's not just about race or the color of their skin, but it's diversity about their intent. How are they going to promote health in a particular population? And we think that's important. This single acceptance issue is very, very important, and it's intriguing to me because nationally, 58% of students are accepted by only one school. But the average number of schools that students apply to is not 1, right? It is significantly north of 5. So there's something else going on here as well. And it's hard to get that data, where they went to undergrad, what are their majors, what are the other things that are resulting in this, what I would refer to as selection bias, that's resulting in just one medical school finding interest in one student. That 58% of the students who get accepted, if that's the case. I find that to be very intriguing. I think there's something there that could help us as well. Now, the impact of the pandemic is significant. When you look at COVID-19, it's been very intriguing. Now, what's interesting about DC is that it's a microcosm of our country in a very, very significant way. If you're a black male in Wards 7 and 8, and for those of you who've been to DC, it's a very small place. So a black male in Ward 7 and 8 has a life expectancy that's over 20 years less than a white woman in Ward 3. Smack in the middle of those two wards is the U.S. Capitol. Most powerful city in the world. Life expectancy, over 20 years difference. We don't have to go far to look for disparities and to try to solve them. And the pandemic threw this wide open. So what was happening during the pandemic is that the folks in Ward 7 and 8 were taking the bus in the morning to go over to Ward 3 and Ward 2 to stock people's groceries, work at the cash register, and they were dying. And nobody was testing them. You had, back then, I mean, all of us now are COVID fatigued, but we may have forgotten. Back then, you had to get a prescription from a physician to get a COVID test. Right? Now it seems archaic that we were doing that. But Howard basically went into Ward 7 and 8 and said, we're going to test anybody who comes in here. And it was alarming what we found. We found that every one of those service workers, long before the national audience was talking about this, were testing positive for COVID and were walking around unknowingly, spreading it to others and going back and forth to work every single day. And those disparities, I think, really impacted what was happening. As I mentioned to you before, medical school enrollment increased as well post-pandemic, and the number of black males, as I said, in the first year increased as well. That increase that occurred in the fall of 2021 has already gone away. 2022, the numbers went right back down. Why? I would speculate again. We started back interviewing in person. We started back requiring people to fly all over the country to go to interviews, and that disadvantages some students, and I think that's something that we have to look at. And it's going to continue for us to look at it. Now, we are the recipients of it was funny, I was walking in the hallway there and I saw this picture of Michael Bloomberg, and I was like, man, I hope somebody in here reminds him that I did put up this slide since I saw that picture. I was like, this is a little airy. But he gifted Howard and the other three black medical schools a $100 million gift to pay off $100,000 worth of debt of any medical student that means tested and would get that. That has, in my opinion, resulted in a dramatic change in what decisions our medical students are making with regard to specialty. So this year, for instance, the number of medical students that we have matched in certain specialties that we had not matched for years has changed, right? We've matched a medical student in neurosurgery. We matched 4 medical students in urology, several subspecialties that we were not typically getting medical students into because they decided to make different choices. They had less debt, the ability to look at moving to a place far away, setting up shop, seem a lot more helpful. Now, what are some of the workforce development strategies that we can employ to affect this? So the first I would say is there's a critical role that HBCUs are playing today that can't be overstated. And actually, to some extent, it's very, very disconcerting. When you look at the top 20 undergrad institutions where Black and African American recipients of STEM degrees, of degrees that go on to get doctorates, et cetera, you can see the HBCUs are at the top. Over the past 25 years, African American students who graduated from undergrad and went on to STEM PhDs in this country, Howard led the way, but most importantly, we sent more African Americans to STEM PhDs than Stanford, MIT, Harvard, and Yale combined. Yesterday, the market didn't do too bad. The endowment for those 4 institutions yesterday was roughly about $150 billion. Howard's endowment is $938 million. We sent more African Americans to STEM PhDs than those 4 institutions. Let me give you a real eye-opener. Harvard's endowment is $50 billion. They have a 5% spend rule. So what that means is they take 5% of their endowment every year and put it into their operating budget. At Howard, we do about 4%. If Harvard were to take their 5% of their endowment, and remember, the endowment is gaining interest, so if they outdo 5%, they're not losing any money. If they took 5% out of their endowment every year, they could run 2 Howard universities. And when I say run 2 Howards, let me be clear. They can pay for all of my faculty and staff. They can pay for every student to attend free in all 14 schools and colleges. They can pay for all of my sports. They can feed and house every single student. And they can put money in my retirement account as well. And they can contribute to my endowment to the amount of money that I'm raising every year, about $175 million, with 5% of their endowment. So the other thing that we have to ask ourselves, and I believe they just got a $300 million gift. I have no problem with somebody giving them $300 million. I think a matching gift would be great, but I don't have an issue with anybody who gives them money. I actually don't like that argument because they're giving to education. They can just give us some as well. But my point is just when we look at how we finance even education in this country, there's a very, very skewed circumstance that's taking place that we're not being thoughtful about as well, I would argue to you. So we're very interested in pre-professional accelerated programs. We have a BSMD, a BS DDS, and And we're looking at more opportunities to do that. We even have a BA/JD, because one of my theories is the fact that the government even looks at a 6-year graduation rate, I find offensive, which is why I've created a 3-year track. A lot of the majors in undergrad have given the students kind of what a 3-year track looks like, so when they pick classes, they can actually get on that as well. We also are doing several things to try to help this pipeline issue. We're bringing students to Howard for enrichment programs in the summer. So I invite every HBCU to send 2 students. I pay for them to stay at Howard. They get an MCAT practice test every week. We then review the results with them. A lot of times it's test-taking issues that they have. They also give them some clinical exposure. We do that for the DAT as well. We now do it for LSAT. And we've just created a program as well for if you are interested in a PhD in the humanities as well. The program and this has resulted in a significant increase in the MCAT scores and more of those students actually getting in to medical school. This is the program, though, that I would say I'm probably most proud of that we created. And as I give you the statistic of how many students we send to the STEM PhD in particular, but we were not doing that by a standard program. This is just the students who were coming to us, and this is what was happening. So we now have a program that's focused on these students. We get 300 applicants every year. We interview about 100 students. My intent was to take 5 the first year as a pilot, because this is one of those unfunded mandates. And as a president, you don't want to take too many unfunded mandates, so you don't want them to be too big. And so I went to my board and said, listen, I want to actually create a program where we cover these students, we put it in give them a structured program. That structured program looks like this. If they get in, we cover all of their expenses. They come the summer before everybody else starts. They do an African American Studies course, a STEM course, and then we send them to Berlin. Why Berlin? We happened to pick Berlin, but the point was to get them out of the country. 80 to 90% of them don't even have a passport when they show up. And what happened here is with the first year, 300 students applied. We said we'd interview 100. My provost came back to me and said, I know we wanted to take 5, we have to take 30. And I said, we don't have money for 5, far less 30. The average GPA for these students was 3.83. And the average SAT score was over 1,400. These students were getting into MIT, et cetera, and decided that they wanted to come to Howard to be part of a cohort. Every summer, they have to go to a lab anywhere in the world and do research. A couple of these students now have published in Nature, Cell. I mean, for any of the nerds in the room, these are my rock stars. I see these kids and I want an autograph. But look at what has happened over time. Average GPA is now, this is the previous cohort. The current cohort's average GPA is 3.93. So these kids are unbelievable. And this is where they have gone. So notice Weill Cornell is at the top of my list in terms of where these students have placed for their research projects. So we're very happy that you guys have been willing to take them. But the point is they've gone all over the world. One of them has gone to Vienna, Austria, as an example. They're winning things like Goldwater scholarships, et cetera. And just to put a face to some of these are the types of things that these students are doing. And this is exactly what they look like. In terms of graduate schools that they've gotten into, again, all over the country. University of North Carolina, Carnegie Mellon, absolutely fantastic institution. So we're very proud of this group of students. But it starts, as we know, much earlier. Howard actually has a middle school on its campus, a middle school that's focused on math and science. So we call it Howard University MS Squared. These students are very interesting. They come to us as a charter school. They perform under the average for their peers when they enter, but they leave performing higher. We don't have a high school, so they go to high school all across the city. 96 to 98% of these students end up going to college. 60% of them pick a STEM discipline. And we believe just from this early exposure in middle school, so they get to go down to our dental school, they get to go to the SIM center, they get to go to the engineering school. If you stop them at the bus stop, they take the same buses that our students take, and you said to one of them, where do you go to school? They'll tell you, I go to Howard University. They won't give you the rest because that's how they feel. So for them, the myth of college has been totally transformed, and they don't see it as uncomfortable. We give each of them a laptop. Often it's the only laptop in the house. We bring the parents in, a lot of parental involvement. The parents have to sign off on homework. Even if they don't understand it, they have to make sure that the homework was done, and they have to sign off on it. We educate them about internet safety and about making sure that the students are accessing the computers for the right things as well. And very, very effective program as well. And so one of the things I would say is that we have to think of diversity not just in terms of who is providing care, but to whom we're providing care. And I would argue that for too long, physicians have been at the center of our healthcare system. And what we have to do is to start putting the patient back at the center. When we think of all the other practitioners, nurses, physical therapists, and actually my mom is a nurse, my youngest brother is a physical therapist, we have to start thinking of the fact that having the patient at the center of our healthcare system is the most important thing. And that can change outcomes significantly, not just diversifying what the folks who take care of them look like. And I think we see a lot of this at Howard. This is our cancer center. We still do a mammogram day. You would think in 2023, DC has one of the highest insurance rates, and yet still we have women who cannot access a mammogram or a physical exam. So we do this once a month. We provide a free physical exam and a mammogram, and we are still, unfortunately, catching people with early breast cancers. The other thing, we set up a vaccine clinic during the pandemic that I think was critical. One of the most moving things that I've ever seen is this woman right here is 101 years old. She got her vaccine from an 18-year-old medical student. She was alive at the time of the previous pandemic. And here, think of what the country looked like then. And here she was sitting at Howard in a vaccine clinic getting a shot from an 18-year-old black female nursing student as well. That outreach was critical. So as I close, a couple of things I want you to think of. One is my mentor, Dr. LaFall, after the Flexner report, could only apply to 2 medical schools in this country. He didn't get into either one. He didn't take standardized tests well. He was an 18-year-old graduate of Florida A&M College, had 1 B on his transcript, and couldn't get into medical school. His university president drove to D.C. to meet with Howard University's president, Mordecai Wyatt Johnson, to convince him to take him into medical school. He would graduate number 1 in his class, and he would go on to become the first African-American president of just about every major surgical organization in this country. He had a saying that I still think is critical for us to recognize today, and that is that the patient must be the object of our affection. He also used to say that hope is the anticipation of tomorrow, and our job as physicians is to provide hope. And when we think of diversifying medicine, it is with that goal in mind to provide hope to so many others. So this is where I think we are. When we discuss, especially with what's happening in our court system today, and we discuss affirmative action, this is really the issue at hand. You can have 3 people of different heights trying to watch a soccer game with a fence in front, and you can give all of them the same help, despite the fact that they're starting from different places. And we call that equality. We call it equity when we give those who need the most help what they need. But ultimately, what we should be doing is removing the barrier. If everybody can see the game from where they are, we'll be fine. And we don't have to be as concerned or worried about what the other person is getting that I'm not getting. And I think that's what we started to get into a very divisive conversation, because we think we're taking something away from somebody to give someone else, when in truth and in fact, we should be focused on the barriers for everybody getting there. Now, Charles Drew, for whom I hold a professorship, had a saying, and that saying was, excellence of performance will transcend artificial barriers created by man. He said that in our department. It's something that we live by today. I'm still a faculty member in that department. I still operate, and so I live by that. And being the Charles Drew Professor at Howard, I really believe that we have to espouse that. So the other thing I want you to be clear about is my promotion in this topic is about excellence. I think that they're excellent medical students that are from diverse backgrounds that just simply need an opportunity. This lady on the left is my mom. She was a nurse for some 51 years. She wanted to be a physician. My grandfather, at the time, who was a high school principal and would later in life become a lawyer, was very disappointed when I told him I was going to go to medical school after spending my life telling him I'd become a lawyer, and that was because he would pay me every time I told him. So I thought it was an easy deal. He was a good man, but he thought that women should become nurses. And so he encouraged my mom to become a nurse, another physician. So one of her dreams was for me, or one of us, I should say, I'm one of 3 boys, to become a physician. He was a good man. So this issue is not an issue that is owned by any one particular type of person or any one particular person with a certain background. It's owned by all of us, including myself. The first time I put together this talk, this was my last slide. My wife came in the room. She has a degree in computer science. So back then, she used to help me with my talks. And she went through the talk. She made some edits. And at the last slide, she said, "This is interesting. You're giving a talk on unconscious bias in medicine, and your daughter is dressed like a cheerleader, and your son is dressed as a surgeon." And I said, oops. So I still leave that slide in, because this is now how I like to end my talk, because the fact of the matter is we all have unconscious biases. And the reality is that regardless of who we are, what our experiences have been, we have to be willing to acknowledge that and to work on doing things that change it. So this young man now is, like I said, at Duke as a freshman, and this young lady is recovering from ACL tear. She had her surgery back in September, had a little bit of scar tissue removed a month or 2 ago, and she's well on her way. But she wants to be an orthopedic surgeon, so hopefully she'll be the future of academic medicine. Thanks for listening and your attention. I appreciate it.
Thank you so much.
My pleasure.
Any questions?
Hi. You walked in the room and I immediately got very nervous. Talking in front of your heroes is not something that I like to do.
That was phenomenal, absolutely phenomenal. So I wanted to ask you, DEI tragically has been in the press in a horribly negative way recently with some misguided, shall we say, politicians claiming that it's a distraction and led to banking failures. When obviously, as you've shown, it's such adhering to DEI principles and incredibly important to strengthening healthcare, and it's incredibly important in strengthening the business world as well. But I worry that some of those headlines are going to have a trickle-down effect on us in healthcare and in education. How do we make sure that we it's a very good point, But for instance, with the banking thing, I'll give you an example of a data point. So last week I was with Secretary Buttigieg. She came to Howard we just won a Department of Transportation grant. And, I was talking to him one-on-one, and I said something to him, and he said, "I've never heard that before, but, it makes sense." And I'll give you what that was that I told him. The life expectancy, as you saw, for a black male is 20 years less than a white woman in Ward 3. If you just use a simple principle of compound interest, there is no way that black male will ever create generational wealth like that white woman. And that's why the median net worth of a white family is 180-something thousand, and for a black family, it's 20-something thousand. And as long as our black population does not live as long, I'm not talking about any economic thing, just the math, we can do it. So one of the things that I think we have to be thoughtful about when we talk about these things is how we talk about them. How do we put these things together in a way that gets people to be more thoughtful about how you get there? And I think one of the things we have to do is to change how that conversation takes place. The second thing is we have to push leadership to own what we're discussing. So, and like I said, it happens everywhere. I just want to be very clear. So when I took over as president at Howard, and I unfortunately didn't have the slide in today, but when I took over at Howard, we had one woman dean. Now, you would argue that at Howard, our DNA is social justice. 74% of my undergrads, as you saw, are female, and we had one woman dean, right? And nobody said anything about it. Nobody complained. Nobody came to me and said, this is a problem. I was shocked. So I decided, okay, we're going to do something about this. So the first thing I did was I published the data about how many women got promoted through the APT process. And sure enough, women were less likely to get promoted. The APT committees were dominated by men. So what do you expect for the outcome? So I said, we're going to change this. We're going to set up committees that were gender balanced. Everybody has to go to unconscious bias training and cultural competency training. At Howard, that almost caused a riot. People were like, are you kidding me? Why do we have to go to unconscious bias? Us? Every single person that went came back and said, I never knew I had an unconscious bias. We all do. When we walk into a room, we look at people through a certain lens, and we try to make some kind of conclusion, because that's how our minds work. This person is well-dressed, he's short, tall, handsome, fat, smaller. Fat is probably not the right word to use in this day and age, but my point is we are processing constantly. And I do it with my medical students. So when I make rounds, I say to my medical students, if I were on the other side of Georgia Avenue, which is where Howard Hospital is, and I was in a pair of jeans, a hoodie, and Timberland boots, I wear 2 of those 3 things occasionally. I don't own a pair of Timberland boots, but I have quite a few hoodies and quite a few pair of jeans, despite the medical students thinking I don't. Who would you think I am? And would one option be that I am a surgeon, president of Howard University? Not one single medical student has ever put their hand up and said that that's what they would think. So which means that we all are operating on that premise of something that we see either from a visual input or something that we've learned. And that's a reality. It's an unfortunate reality, but it also means that we have to start examining on an individual basis what it is we're thinking, and then move that to action and take action. So I'm happy to say today we have 14 deans, 11 of whom are women, 11 fantastic women who are deans, but it took a process. And I said to them, I'm not going to interview any finalists unless one was a woman. And the only thing you don't want to do on a search committee, if you've ever been appointed to a search committee, is to do it twice. Right? So they've never come back to me and said, we didn't find a qualified woman candidate. And now we have 11 deans. But you have to take action, and it has to start with leadership, but you have to also be practical about it. So sending people to unconscious bias training was helpful, because it made the point that, listen, this is not Dr. Frederick's issue. This is our issue. We all have to own it. And when we participate in these things, we have to own it. I gave you, my vignettes about my interview process in places I've interviewed. I mean, I'll tell you one of the things that's a little embarrassing. I won't tell you who it is just because of how embarrassing it is. But Friday, I was at the American Surgical Association, and I was sitting at a table with a very, very senior female white surgeon who had just given an incredible talk on burnout, bias, etc. And she sat next to me, and everybody was talking, and she turned to me and said, yeah, like you medical students, you guys aren't, really, you guys have a different generation, a different mindset. The other people on the table were mortified because they all know who I am. And they kind of looked at her like, are you kidding me? And so, she clearly could see that there was some discomfort. And so I turned to her and I said, hi, I'm Wayne Frederick. Nice to meet you. And so the conversation went on for 10 minutes, and then she couldn't take it anymore. And she said, who are you? And I said, I'm the president at Howard University. And she said, you are kidding me. She said, well, it's flattering that you look like a medical student. I said, is it? Right? It isn't flattering that I look like a medical student. I mean, you should make assumptions. But she made an assumption. But that's what we do. Now, I wasn't offended. I went home and told my wife, somebody thought I looked like a medical student, so I got some points there. But we all do it. And she had just given a talk and she had told stories about how people treated her as a female surgeon. And she looked at me and assumed, and that happens to me all the time. I have a white VP for development. I can't tell you how many times, and I had a white CFO, Mike Mash. I can't tell you how many times I've walked into rooms. So we have to come to Wall Street, for instance, once a year, and I've walked in the room with him. He's a white CFO, and they know it's Howard. They know it's a historically black college and university, and they walk in and they get up and say, hey, hi, Mr. President, and shake his hand. And then I walk in behind and I say, hi, how you guys doing? And I sit down. And it's just in our DNA. So you have to just keep working at it. And I think also, the last thing I'll say about it is I think sometimes we take ourselves too seriously. So even in that little exchange with that white woman, I don't think she means any harm. But part of what I hope she takes from it is some of the things that people have done to her may not have been done with malice. The same way I don't think what she did with me was malintent. And part of it, to be quite honest, is that she was dismissing. I hadn't spoken yet, right? We were sitting down having lunch, so it was an informal conversation. But part of what she was doing is, you're a medical student, so you can listen in on this. You don't really have anything of importance to say here, right? That's part of what she was doing inadvertently.
To you in a second. Just one question that I wanted to follow up with because it's very pertinent to what you're saying. I think the engendering conversation and finding the ability to create, start, and hold these types of conversations in community is the only way that we can all accomplish everything, no matter how well everyone's intentions are. I think we've all experienced this. You bring together the best minds and everybody that has, the most competent backgrounds to solve these problems, and you sit in the room, it is just, you could drop a pin. And it's very hard to know how to get those balls rolling and how to make everyone feel comfortable that their voice, no matter their background, is okay to be heard. And I think that that's a really important thing that I would love your opinion on.
Sure. Yeah, it's a great question. So the first thing is, I think we should not have this conversation in a pointing fashion, right? Which is why I always end the talk the way I do, just to make it absolutely clear that this is not me coming to preach. Church is for sinners. It's not for the faithful. Church is for sinners, right? If we all weren't sinning, we wouldn't need a church, right? When we need a church, we're all doing the right thing. Church is actually for sinners. So we have to come to the conversations thinking that there are things that we can do better, right? And be thoughtful about it. The second thing is, we have to spend time getting to know other people. So my white CFO, who unfortunately died a couple of years ago, Super Bowl Sunday, was Jewish, right? Mike Mash. Grew up in Philadelphia, was working at a school in New York when I recruited him. Every Jewish holiday, he would take off. Nobody would say anything, but it was obvious that he was missing. And nobody ever complained to me. He's a gregarious guy, great guy, very competent. But I thought to myself, there has to be something going on here quietly. Right? We're at a historically black college and university. We have a white Jewish CEO. He's never here on Jewish holidays. Somebody has to be thinking something. So he was getting ready to go off on a holiday, and I said to him, Mike, when you come back, I want you to I'm going to have a cabinet meeting. We're going to surprise the cabinet. I want you to tell the entire cabinet what holiday you went on and what you did. And he looked at me again with that kind of suspicion, like, what is this about? Obviously, he went, had a great time, and he came back. And what do you think he did? He bought all of the silverware. He bought green apples, honey. Anytime I tell a story, I never say the holiday because I'm like, I'm going to mess the holiday up. Somebody in the audience who's Jewish is going to say, you didn't even get the holiday right. But every time I tell it, though, the Jewish people in the audience know exactly what I'm talking about. And he passed it around. We dipped the green apples in the honey. We all ate. And listen, his face was bright red. He was so excited because what had we done? We did the simple thing that all of us should be thinking about doing every day. And that is we amplified his humanity. And that's what we should be doing. We are getting into a space in our country where we're respecting everybody's humanity. And that also means that if you live in your space, I live in mine, we're going to be good. I don't think that's what we should be doing. We should be amplifying each other's humanity. That means that we should be actively trying to find out, get educated, and engage. The first time I knew what kosher was, I was a fellow at MD Anderson. Very smart people never want to admit what they don't know. So we hear the word kosher, and we make assumptions. And we say, yeah, I know what kosher means. We don't know what kosher means. So I was operating with Merrick Ross one day. We had a very tense interaction taking place. And I said to him, I blurted out and said, what is kosher? And he looked at me like he could throw the instrument at me. Middle of a tough case, why are you asking me? But he looked at me and he could see that I was being genuine. And he started explaining. We finished the case calmly.
He took me to a place to show me what kosher was. It was incredible. The education about it totally changed my perspective about what it meant. But how often do we make assumptions? We hear something all the time. We hear something like Kwanzaa. We don't stop ourselves to do the research, especially for smart people, because we never want to admit what we don't know. And so that example of my CFO, I would say changed my team dynamic. Everybody in the cabinet looked at him differently. They could feel the palpable excitement. And then the only burden was that every time he went, he had to come back now and explain where he went, because people were into it now. But my point is, I think what we have to do to have those conversations, sometimes we jump into the conversation and it gets accusatory very quickly, versus we should spend time on the front end just understanding who's there. So sometimes I see these committees get put together and people go around the room and they identify themselves, but how do we identify ourselves? I'm Wayne Frederick, 17th president of Howard. That's not who I am, right? I'm the father of 2 great kids, they're 18 and 60. I mean, when you start getting into those conversations, you stop yourself and say, oh, that little list I have is because I'm from Trinidad and Tobago. And by the time you finish with a proper introduction of who that person is, it's a different conversation. But those are not the things that we typically do. Everybody identifies their position versus what's really true about their humanity. And so there are different ways we could set these things up that I think can be very effective.
Thanks so much, Dr. Friedrich. That was a great talk, very eye-opening. And you kind of already addressed it a little bit with this conversation about assumptions. Your story earlier about this speaker who was talking about bias and then just immediately had a bias yourself kind of brings up a thought that I have about, fatigue when it comes to fighting this bias, right? Because as you said, it's almost subconscious. It's inherent. You walk into a room. We don't all have that childlike mindset and innocence where you don't make assumptions. So as adults, we're constantly making assumptions. And I think if you are kind of open-minded and want to truly know more about a person, you're fighting those biases sometimes on a daily basis with every patient interaction, with every human interaction. What are your thoughts on that and kind of the fatigue that might come with that? I don't want to say walking on eggshells, but in some ways that's what you have to do.
It's a great point. I think one of the first things we have to do is we have to live it. It can be something that we put on because we go to see a particular patient or we're interacting with a particular resident of a particular gender. It has to be something that is innate in us. And I'll give you an example again of that. I was at University of Connecticut Health Center, and I lived there with my wife. At that time, we didn't have kids. We were a young couple. So we would drive down to Manhattan twice a month, to get some excitement. Unionville, Connecticut is a little quiet. Farmington is a little quiet. So we would come down and we would stay in Times Square so we could get the most stimulation you could get possible. And so one time we would stay at Times Square, the hotel in Times Square, and I got on the elevator, coming back up to the room, and a guy got on the elevator, and I swear he looked like Alec Baldwin. For the longest while I thought it was probably Alec Baldwin. And so he gets on the elevator, and he says, there are probably 5 of us on the elevator, and he says, hey, hi, how you doing? Oh, the weather's great outside. Oh, my gosh, you look like, you're having a good day. And I thought to myself, I got off the elevator, I had a big smile on my face, and I was like, man, why was that so invigorating? So I go back, I rush to the room, and I say to my wife, I just met a guy that looked like Alec Baldwin on the elevator. He was the greatest guy. He was talking to everybody. He made eye contact. And she said, it's Times Square, sweetheart. Are you crazy? He's crazy. Like, you don't talk to strangers on the elevator in Times Square. And I thought to myself, oh, yeah. But I was still thinking in the back of my head, that was such a pleasant experience. What do we do when we get on the elevator, typically, right? We all do the same thing. You just checked your email. There is nothing new on your phone. But we have gotten so conditioned to not look people in the eye, not talk to people. That's what we do. So later that evening, we go out to dinner. We get on the elevator. Who's on the elevator? Alec Baldwin guy. And I was like, wow, this is going to be interesting. And sure enough, he turns to everybody. He says, hi. He turns to my wife and said, oh, my God, you're gorgeous. I love that dress. We got up the elevator. She's like, that's the greatest guy in the world. I was like, time out. I just told you that. And I couldn't stop laughing. But it taught me something. So at Howard, one of the things I tell the staff, in the hospital especially, is when you get on the elevator, do not look at your phone. Just say hi to somebody. You'd be surprised how many opportunities we have every day to make what you're talking about innate in our being, whether we're introverts or not, right? Think about introverts like myself. Introverts like myself want to be around people. We just don't want them to talk to us, right? So it's not that we want to be isolated. The pandemic taught us that. The essence of the human condition is engagement. It's not isolation. The pandemic, I think, brought that home to us loudly. We want to be around people. Even if you're shy, you just don't want them to talk to you. So you want to get in a room with 4 people and let the 3 of them talk, and you listen, and you're good. So the point is, even when you get on the elevator, you have an opportunity every day to just look at somebody and say, hi, good morning, how you doing? And you would be surprised that the more you practice that, you'll get there, right? People sometimes say, I'm shy, I seem unapproachable, I get that rap. And I notice this every time that I make an effort to just simply smile back at somebody or to say hi, it changes how they also. And when I say people say unapproachable, I mean, you're the president of the university, people get in an elevator with you, they're like, oh my gosh, they don't want to make eye contact. And you definitely don't want to ask somebody to come meet with you because it's like the sky is falling in. So for me, it's incredibly difficult. Even if I walk around campus, people are whispering. It's the most awkward interaction you can have. But you recognize that every time you make it that much easier for somebody to be themselves, or for that matter, to open up, it becomes easier. So by the time you come to these conversations, you're fine. But to your point, if you're running around every day, kind of on eggshells, you're tense about it, you're not interacting with people, to come and then have a tough conversation, it's impossible for you to do that. If you don't even say hi to them in the elevator, why do you think you're going to get in a room and all of a sudden something in you is going to allow you to really have a tough conversation? It's impossible. But it's a culture thing as well, right? And I'll end my answer on that note. Culture is 2 things, in my opinion. It's tolerated behavior and people. And a big part of it is how you set the tolerated behavior. And sometimes we think the tolerated behavior is set from the top down. I would argue that the tolerated behavior is set by the rank and file. The minute you see somebody doing something good, because we often think of the negative, but when you see somebody doing something good, how often do you stop and say that was kind of you? Right? You see somebody on the elevator do something like that, or you see somebody make an extra effort to walk a patient. How often do you go behind that person and say, hi, my name is so-and-so, what's your name? I just want to tell you that was really kind of you to help that lady. But we don't do that. And so I think we can elevate the tolerated behavior every single day in our household. We can elevate the tolerated behavior, right? We have it every single day. You get into an Uber, you go into the grocery store. There's so many times you're interacting with people. And if we just think about amplifying people's humanity every single day, I think we'll all get there.
Thank you, Dr. Frederick, for an outstanding presentation. As you were speaking, several things resonated with me, but one of them was you talked about your supplemental application and the question that you pose, how these prospective students plan to care for underserved populations. And part of this is related to Dr. Newman's question with the impending decision coming from the Supreme Court. Do you see that as a way of ascertaining commitments of future physicians and not losing ground with respect to workforce diversity?
Yeah, it's a great question. I actually see it from a much more daunting perspective. I actually see it as something that we probably won't be able to do by law. We may not be able to pose that question by law. Even in an interview process, we may not be able to ask somebody, what's your interest in serving an underserved population? I mean, that's how serious what the Supreme Court is getting ready to do is. And the other thing I see as daunting is if that happens, my 32,000 applications could explode to 60,000. My 11,000 med school applications could explode to 20. Because what I think is going to start happening is students are going to try looking for what they consider a safe harbor. And I think that gets us into a very problematic place, right? I don't want every black student to come to Howard. And I don't want every student at Howard to be black. Those 2 things are not the ideal. The ideal is that we have a more diverse population everywhere.
And so I think this, as Dr. Newman was saying, when we look at where our country is, I think sometimes when we look at these issues, we think it's going to affect somebody else. And I think that's the mistake that we're making. This is our problem. All of us have to own it in this democracy, which means that all of us have to be doing something to actively correct it. The thing about banning books, I listen to people complain all the time about the book banning. And then I say to them, when was the last time you went into a middle school and read to a student? Right? We think somebody has to go pass some big law in Congress to fix a problem. That might be true, but in the meantime, the rest of us could, on a Saturday morning or on a Friday afternoon, volunteer to go sit in a middle school and read a book to a student, regardless of the content. The point is, we have to encourage that curiosity that's being suppressed in a way that we can control to be good citizens. And I think there's several examples like that where we don't participate in our community enough to make sure that that happens. And I think ultimately the will of the people is what will get us there. And so I think it's daunting, but I also think that we have to start thinking now of what our civics education looks like, what our public schools are doing, and how we are participating in that rather than just pointing fingers.
Thank you. Exceptional communication and public speaking. I find it hard to believe you're an introvert after all of those stories. My question is from one of the people in this audience who helps to run some of the graduate schools here and pipeline programs. Certainly there was a reaction in the summer of 2020 when many of us thought that our problems could be solved by just simply reaching out to the HBCUs and inviting their students here. And I did manage to connect with a biology professor at Harvard who, in very frank terms, essentially said that many of us were trying to be body snatchers of like, all right, fine, you're here now. Where were you before? And are you still going to be here in 5 years? Wow. I think that was a very realistic reaction for many of us who just thought that we could simply show up then and really start to pay attention. Do you have any advice for many of us who are still in the game, who still really want to show up, want to help, want to change the components of the people who are in our hallways?
Yeah, it's a great question. The podium is good protection for my introvertedness, but show a cocktail hour and you'll see me on display. So a couple of things I would say about that. One is, when this started, I had a saying, which I used primarily at Howard, but I'll share it here with you. Howard has been on the caravan to social justice for 150-something years. This period in time, we have people who've joined the caravan, and that's great, but they will also leave. But before they leave, we need to sensitize them to what the issues are so the issues never leave them. And we need to make sure that they give us new tires, new carburetor, put some gas in the tank, etc., while they're with us. And sure enough, that's what has happened. The peak in philanthropy to social justice issues occurred in 2021. We have now returned to giving to social justice issues that's less than it was in 2019. And I predicted that back then because that's the cycle that we're in. So what I would say is what we are often looking for is a relationship, not a transaction. And that's the biggest thing that I try to tell people. My students are looking for a relationship, not a transaction. They don't want to come to a place where it's going to be a one-off. So one of the most successful relationships we have is with the University of Utah. The president of the University of Utah, pre-George Floyd, came out to see me. He was the dean of the business school. And he said, I want to bring students to Utah. And I said to him, Salt Lake City? So that might be a tough sell. He said, no, we'll introduce them to entrepreneurs and we'll put them in different businesses. And I said, okay. So he took 6 students out there. They went to a place called Pluralsight. They went to the Utah Jazz, etc. The other thing they did is they got the black community, the black business community, to support them. So they took them to cultural events, etc. At the end of the summer,
I get a call from him, and he says, "Oh, this looks good. We'd like to expand it." And I said, "What looks good about it?" And he says, "Well, 2 of your students enrolled in my grad school, and one of them took a job here." I was like, "Hold a second, that's 3 of 6 of them. Like, let's have a conversation here." The next year, he took some medical students out there. 2 of them matched in anesthesiology. It's Utah, Salt Lake City, right? There's a medical student I trained who is an attending there, and an attending I trained with at MD Anderson, a white woman who's there. The support system is incredible, and it's a genuine, concerted effort of a relationship. The other thing is their students come to us as well, which is the other thing nobody ever proposes to us. They always say, we want your students to come here. And I say to them, well, I think your students will have a great time if they come here as well. Same thing with faculty. So I think it has to be, an even exchange, and it has to be with a relationship in mind and not a transaction. So it can't just be about numbers. Even if it results in only one student doing it, the bigger aspect of it is the exposure on both sides. So when I talk to the students who go to Utah, they tell me all sorts of things about Utah that I never knew. They go to rural sites as part of the rotation in the summer. I mean, it's a full-blown exposure and cultural exposure. And they obviously get things from that as well in terms of the people they interact with. And that's what makes a relationship rich. So what I would suggest to you is I think people are cynical as well about it at a place like Howard, because yes, we've been there doing that, but the reality is that, I think if somebody approaches us from a relationship perspective, we tend to be very welcoming.
Mm-hmm. Thank you. I don't know if we have time, but again, I'll echo the comments with respect to your skills in communication. Thank you. You're always engaging. If I didn't have a full operative schedule, I'd follow you to Tennessee, but tomorrow. The comment I have, it's not a question, is one of just understanding the workings of somebody in a position like yours, of a very prestigious and large institution. The struggle with regard to the selection bias, homogenizing your student population, and you made the comment about you need to embrace diversity at your college. The rest of the world is not there, obviously. So yes, you have a responsibility during that 4 and 6 year time period to provide your students with the diversity. But when other institutions aren't keeping pace, does it really become your responsibility? I mean, you need an access portal, and that access portal, you've proven, is phenomenally successful. Yeah. How much do you struggle with it, or do you?
Yeah, that's a great question. As you can imagine, I interact with a lot of university presidents, and the conversation is often, as you can imagine, all over the place around this issue in particular, and kind of how we pose that. And one of the things I point out to those presidents is when a student comes to Howard and they get a D, they earned it. They don't feel like somebody is, treating me any differently. You get a D, you earned it. You did something to get a D when you're a student at Howard. And I think that in and of itself allows those students to feel a different way. I mean, people try to describe it as it's familial, etc. I reject those things. I think it's a rigorous academic environment, but I think it's also an environment in which self-actualization is allowed in whatever way it is. And it actually is one of the most diverse places you could be. I went to Howard in 1988. When I met the kids from California who were listening to Tupac and the kids from New York who were listening to Biggie, I thought they were from 2 different countries. I was like, these kids are very, very different. They dress differently. So even that diversity among Black people in America is underappreciated. Somebody who comes from Selma, Alabama is very different from somebody who grew up in Compton, California. And so the other thing I think when we think of diversity is that we use that catchphrase of it's deeper than the color of your skin, but the reality is that when you let people come with who they are, you have to do it. So in terms of that access portal and interacting with others, yes, I think Howard has a very special responsibility, and I gave you those statistics. The fact that we send more African Americans from undergrad to STEM PhDs, and those 4 institutions over 2.5 decades is part of the American higher ed tragedy and part of what has to be addressed. But who's going to address it, right? If I say, well, I'm just going to do what I do here, and, if, Weill Cornell calls me on a Monday and, I have to go to Tennessee tomorrow, I'm not going to come here because, it's going to say the same. I think that's a cynicism that, A, the president of Howard can't afford, and B, is not fair to what somebody here might be trying to do, right? I think my goal when I come to places like this is to try to just give a different perspective. And that may stimulate somebody to say, okay, I'm going to do something different. My biggest litmus test for when I give talks like this is if I look in the room and the room is not representative of who's here, I get concerned, right? I've given a talk at every intelligence agency in DC except the CIA, so FBI, NSA, you name it. And I was most impressed at the FBI. I went to give a talk there. James Comey met me in the hallway. He came in, he introduced me. He sat in the front row, he took notes. When I was finished, he got up and gave feedback. And the agents looked like the FBI looks. And I was stunned. And then he followed up with me. I invited him to spend a year at Howard. He did that. I was like, this guy is serious. I came to find out that the trainees at Quantico, he made every one of them have to go to the Martin Luther King Memorial and look at one of the quotes and write a story about it because of the relationship that the FBI had with Martin Luther King back in the day. He made that as a point of, this is how discrimination works. This was a civil rights leader who was trying to do A, and we spent all of our time in the FBI trying to get dirt on him to bring him down. He was very transparent about it. And so my point is, when I see leadership participate in that type of a way, or if I came in here and 90% of the audience was black, I'd say, okay, I'm going to do it, but it's not going to have an impact, right? And I think that's the people who show up today is an example of the fact that, people are interested in the topic and people are serious. So I try not to let the cynicism set in. And the second thing is, I try to encourage my colleagues that there has to be a different way for all of us to participate in trying to solve this problem. I think Enzo wanted to...
Thank you very much, Dr. Frederick, for coming here today. And we're lucky in this room. We're lucky in this medical school. We feel fortunate in New York City and so forth. We resonate to the same principles. In the Department of Surgery, I have Lisa Newman, and here with Linigo Lightly, we, again, as I said, resonate to the same principles. And after the killing of George Floyd, Breonna Taylor, and everything else, as you mentioned, 2020, 2021, that gave voice to all of us to speak what we really feel about diversity, the value of diversity, the value of different opinions, and so forth. But as you mentioned, the recent events are concerns, whether it is the Supreme Court, whether it is the appointment of Bert Ellis to the board of UVA, and so forth, that gives concern. Concerns that we were able to speak our mind, but probably we didn't convince many. And those many kept silent, and now are coming back again with their own principles, anti-diversity, justifying that a movement toward diversity will dilute quality, will decrease quality, and so forth. So what are your pearls of wisdom for all of us for the next, say, 3 to 5 years? Thank you again for being here.
Sure, appreciate it. A couple of things. I'm an immigrant to the U.S. I came here to go to school. Had every intent of returning to Trinidad and Tobago as soon as I was done. And I fell in love with what I think is, one of the greatest countries in the world that has a democracy, as I was saying earlier, that's messy. But it works. But it only works if the people participate. We all have a responsibility to participate. And sometimes I think our participation is measured by the magnitude of that impact. And I think that's often misguided. I think we have to just be fully engaged and participate every day. And I think if all of our institutions, whether it's higher ed, our financial institutions, whatever it is, continue to demonstrate that diversity does make these places better, I think that's going to win the day eventually, regardless of what law you put in the books. One of the things that I've heard several times before that I think is true is that you cannot legislate love or hate. You can't legislate it. I don't care what law you put on the books to either force people to love or force people to hate, it doesn't hold up. It is the one human condition, our ability to love each other, that cannot be legislated away. And so we have to create opportunities and spaces for that love to shine, and it shines through in different ways. You know, one of the issues with diversity, I think, is that we often don't recognize that we're trying to amplify other people's humanity. We focus a lot on numbers, on quotas, on, you know, kind of what the overall macro is, but we don't often focus on the individual. And I think as institutions, we have to do that. I think over the next 5 years, we have to participate very actively in our democracy. We have to get young people to get out and vote. We have to vote. But not just vote blindly, we have to understand all of the issues, right? We have to ask the questions. One of my most embarrassing moments was rushing to vote in an election, took my kids, who couldn't vote at the time, but wanted them to participate. I get there, and, you know, the top line candidate, you know, clearly knew, and looked at the rest of the boxes and, you know, kind of looked around at my kids and filled them out, and we got in the car, got home, and both of my kids ran inside. My son said to my wife, "Dad doesn't know who he's voting for. He just voted." And I was embarrassed, you know. And so I sat there, I was like, "Shh, listen." And so every year now, before I take them off, my son can vote. You know, we sit down and we go, and I'm amazed. I mean, even something as simple as that, there are probably 40 votes that we cast when we do those things, where I would argue the average American votes on 2 of the top line things. So even something as simple as that, how we exercise our right, we don't often do it in the best way. We don't do it in the way that is intended. So we don't participate in our democracy fully like we should, right? And especially for highly educated people, we have a responsibility to do so. The third thing I would say is that charity starts at home. I talk about generational wealth a lot. I didn't come from generational wealth. I'm the president of a university. My mother is 77 years old. I have no clue what her finances look like, none. And I dare not ask her, right? That's crazy to me. But every New Year's Eve, since my kids were, I think, 8 and 6, I sit at the dinner table with them and we go over all our finances, like open book. I tell them what I make. I show them what we paid in taxes. I show them what we have saved, what our will looks like. The first 2 years were traumatic. My wife got up from the table crying. She was like, "Why are we talking to 8 and 6-year-old about us dying and who they're going to live with?" She's like, "This is torture." The last conversation, which occurred this past year, was my 18-year-old son like, "So why does this trust thing work until 23? Why can't I get the money before?" I'm like, "You have a plan or something?" But the point is now they participate, right? He's questioning my investments, you know, why I put money in. I'm like, "Dude, you just spent 1 semester at Duke. Let's slow down here." You know, like, I have a financial advisor. You know, he wants to know, why are you buying stock in? And so the point again is, even what we do, I think, in our own personal lives has to reflect what we want to see. And I think that we have to push ourselves to make sure that we're doing those things. And the last thing I'd say is, we have to keep hope, which is the comment I made earlier about Dr. LaFall. Hope is the anticipation of tomorrow. And we have to anticipate a better tomorrow. If we don't start with that principle, I don't think any of this is achievable. But we all have to have that hope that there'll be a better tomorrow. But that starts with us. It doesn't start with whoever is on 1600 Pennsylvania Avenue. All of that will be good, but ultimately I think it starts with each of us. Listen, thank you very much for your attention. Appreciate you.